Hey guys, so it's me. I'm here to talk about one of the hardest surgeries that I've ever done. Um, it was by far, in terms of it being hard, it was by far the most painful one, the longest one, the one with the longest recovery, and I'm just basically here to talk about it. So lately, it's about it's been 6 or 7 years since I had the surgery, and what it was a jaw surgery, and the entire purpose of me getting it done was so that I can correct my bite. So I'm not really familiar with the exact name of the surgery, so I call it the jaw surgery because it's the only jaw surgery that that I've had. But if you are familiar with the name, you could drop it down below the comment box, so when other people see this video, they know exactly what surgery I'm talking about. So to just give you a little rundown of what it was that I did, it was that basically what they did was they put this device into my mouth, in the operating table and whatnot. And what that device did was that it broke my upper jaw, so they can move it forward. And the entire surgery basically takes a good amount of hours, but then afterwards it's about like 3 months to actually complete it. And then after the 3 months, you have to have a second surgery to have the device removed. So yeah, that's pretty much why it was the most intense surgery. I've had about like over 10 surgeries, and those surgeries were about 3 to 4 hours, maybe top 6. And afterwards, I would just come home, take my pain meds, and in about 2 to 3 weeks, I would be okay. With this surgery, I was not okay. I woke up from the operating table, and there was this big metal thing, like I'm talking about like transformer thing, coming out of my mouth. And they had to tape my tongue to the side of my face with this little string that I didn't know was there. It freaked me out. But okay, so I wake up, my tongue is there so that I don't know, swallow it or something. I'm not 100% sure why that was there. And it was just horrible. I was in so much pain. I couldn't eat. My parents were sleep deprived. They were, so worried about me waking up and me, recovering and all of that good stuff. So, safe to say the first week was kind of ridiculously crazy. Interesting fact was that while I was having the surgery, I believe it was like a fairly new technique of doing this. So I was kind of like one of the guinea pigs, so to speak. So I was maybe like in the top 5 of individuals that actually went through with the surgery and did it. So when I woke up, the cool fact was that right next to me, there was another individual, there was another patient that had done the surgery a couple days ago. So that kind of gave me like a little cool spirit where I was like, yeah, I'm not the only one. But then it was kind of bittersweet because you don't want anyone else to go through that pain. But it was just good to have someone there that I can kind of like look over to and wink, because I couldn't really speak. I couldn't speak for 3 months, just saying. But that was actually like a cool fact to do. But after that, recovery time after the surgery was about like top 6-7 days. I ended up coming home on like the 3rd day because I was not having the hospital. I said I want to come home, and if that means I have to show good health, then body, I don't know, like just start working with me. So long story short, I ended up coming home within like 3 to 4 days, which was great. While at home, the part that was kind of hard about the surgery was that you can't eat for 3 months straight. Like you have to be on a liquid diet. And also, it's really hard to speak because they have these rubber bands that hook the device down into your braces. Well, I had braces, so into my braces, and basically that was to keep the jaw shut So imagine not being able to talk, not being able to eat. It was just really frustrating at some points. And then I had these two metal rods sticking out of my mouth, well, out of the device really. And for 2 weeks, there were these screws that my mom had to turn, I think, well, maybe around like twice or something like that. And that was the hardest thing. Like, forget the surgery, forget the eating, forget the not being able to talk. Those two little screws and those 2 turns a day, that was what killed me. Like, physically killed me. Like, I was dead. And it was mostly because it was so painful, turning those screws, that all I remember from those 2 weeks was just me in bed, like, just screaming for hours on end because I couldn't take the pain. It was like you can feel your bones moving, like you know when you grind your nails on a chalkboard or when you grind your teeth. It was that kind of pain, but just non-stop for hours on end. And no matter how many pain meds they gave me, it would not pass. It was something that you just had to work through until it finished. So that was probably by far one of the toughest things about that surgery. Then it was the whole not being able to eat, so I was drastically losing weight, and it just looked so bad. I went from being to normal weight to just really, really not, like, unhealthy looking, kind of, almost around there. At least for like my body type. No one's ever seen me drop that much weight, so it was kind of weird and sickly almost. And on top of everything, it was summertime. I was maybe I had just finished 8th grade and I was entering 9th grade, but because the surgery is like 3-month span, I couldn't enter high school with everyone else. So I was basically homebound. So not only did I not enjoy my summer, I didn't make any friends. I couldn't check out the area where my high school was, and I was being homeschooled for about 2 months because I didn't start school until late October. And that was because in order to remove the device, you have to have a separate surgery to get that out. So it was like surgery on surgery and then recovery on recovery. So I definitely didn't make it to school on time. You could say that. So it was really hard on top of everything. And then actually going to school as a 14-year-old, and I'm fresh in this high school. Everyone's already made their friends in their little groups, and I was just thrown in there, not knowing a thing, and trying to catch up with everyone, trying to catch up with math and reading and English and like social studies, I think it's called. I don't know. It's been years, but the point is that there were so many pressures put on me, not only physical, mentally, but also, socially, trying to have a life at the same time. So that was all pretty darn stressful. Now, it does sound like I had a sucky time, which I did. I'm not gonna lie. I'm not gonna act like it wasn't a very tough or hard experience. But it is one that I will never turn my back on. It's one that I don't regret doing. And it's also one that I'm very happy that I did. Before the surgery, my doctors were very good at informing me in what I was getting myself into. They gave me books and kind of like guides on what to do, what not to do, what should I expect, how to mentally prepare myself. Again, the surgery was really tough, so there's really nothing that anyone can say or do or show me that could have prepared me for what happened. But at least I knew what I was getting myself into. Also, my doctors showed me like before and after pictures of what I should end up looking like versus what I looked like at the moment as a 13-year-old. So that was pretty cool to see. It was kind of like a motivator to do it. Because again, like, no one wants to go through that. It was really tough for me to say yes to it. So, they did a lot in terms of calming me down and actually making me feel good about the surgery. But in terms of everything else, it is very scary. So, you know, if you're thinking about doing the surgery, just know that you're not alone. You're not the only one that's done it. It is difficult, but if you have a great team, you're going to see great results. You know, if you have a good support behind you, you know, you have your family there, or your friends, whoever it is that you find close to you, if they're there supporting you, no matter what age you are, no matter whether you're working or going to school, whatever it is, if you have a good foundation, you're going to be able to do this surgery, because it's not something you can do on your own. You have to have someone there to have your back and to, you know, kind of hold as your rock, because if not, you're going to enter a really dark place, and that's not something that you want to go into. Even though I had a support group, like, I also entered, you know, a dark place. I got very depressed. It was very saddening in a sense, just because of my age and the things that I missed out on and everything. But now, about like 5 years later, like I said, I don't regret it. I'm very happy with the results. Again, later on, at the ending of the video, I'll flash the before and after pictures. I'll flash the preparations I had to do with my braces, and I'll flash how it ended up looking. I mean, clearly you can see me now, so this was legitimately the end result. But I'll hone in on it, and I'll show you really focused pictures on how that surgery ended up happening. Of course, that was not my last surgery, but it was the one that traumatized me the most. After that surgery, I could not look at an operating table the same. You know, I've had phobia of needles. I've had phobia of masks on my face. Every time I would go into like the operating room, I would get like panic attacks. So to me, it did a number on me. But once my journey was over, once my treatment ended, you know, I was happily able to say, I'm never going to see a mask in my life. No one's ever going to put me under anesthesia again. So I'm okay, you know, and if it does happen later on down the line, then I deal with it. And I know my body. I know how I'm going to react. I live in it. So I end up trying to take precautions necessary to prevent me having a panic attack or me freaking out and stuff like that. A lot of the prevention goes into speaking to other people that have had the surgery that I'm about to do, or just speaking to my friends, and they help me out a lot. You know, there's no better feeling than waking up and seeing your family and friends there waiting for you to wake up, and, you know, you made it successfully through another surgery. It's a bittersweet moment, but it's one that I'll never ever take back. So again, if you are thinking about doing the surgery, please do your research. I hope this video helped you a lot. You know, talk to other people that have done it. You know, don't be afraid to comment or, you know, email me personally. I would not mind speaking to you. If you need a support group, I'm always here for you. You know, but definitely do your research. Make sure you have a good team. Look at the patients that they have done the surgery on in the past. Look how their results have come up to be. You know, it's a life-changing surgery. It's like physically it changes you a lot. So that's definitely one thing you want to look into. I remember I woke up and my face did not look the same, and especially after they removed the device, I did not expect to see the face that I have now. So that was kind of like a really interesting mental change that I had to go through. So definitely do your research, and, you know, I really do hope this video helped you. And now I'm going to go into flashing before and after pictures. So I'll say this now. Thank you so much for watching. I really do hope you enjoyed the video, and I apologize greatly if I began to ramble. Alright, enjoy, you guys. Until next time.